When people ask what the biggest health problem in the United States is, they often expect a single disease as the answer, like cancer or heart disease, but the truth is more complex because the greatest health crisis is not just one illness. It is a web of conditions, behaviors, and systems that together shorten lives, reduce quality of life, and drain families emotionally and financially. And at the center of this web sits chronic disease driven largely by obesity, poor diet, physical inactivity, stress, and unequal access to care. Chronic disease now defines modern American health more than infections or injuries ever did, and it develops slowly over years, so many people do not notice how serious it has become until complications appear. Heart disease remains the leading cause of death, and it is closely tied to high blood pressure, high cholesterol, diabetes, smoking, and excess body weight. Stroke follows a similar pattern and is often the result of long-term damage to blood vessels caused by the same risk factors. Type 2 diabetes has reached epidemic levels, and once it appears, it increases the risk of heart attacks, kidney failure, nerve damage, blindness, and amputations. These conditions do not usually arrive alone. They cluster together in what doctors call metabolic syndrome, which includes abdominal obesity, insulin resistance, high triglycerides, and high blood pressure, and this cluster multiplies risk far more than any single problem on its own. Obesity is one of the strongest drivers behind this crisis because it changes how the body handles sugar, fats, and inflammation. Extra fat tissue is not just stored energy, it acts like an organ releasing hormones and inflammatory chemicals that disturb normal metabolism, and over time this raises blood sugar, strains the heart, and damages blood vessels. A large share of American adults and a worrying number of children now live with overweight or obesity, and many develop related diseases in their 20s and 30s instead of later life. This means decades of medication, doctor visits, and reduced physical ability. Diet plays a huge role because the modern food environment is built around convenience and profit rather than health. Highly processed foods rich in sugar, salt, and unhealthy fats are cheap, widely advertised, and engineered to be hard to stop eating. Portions have grown larger over the years, and sugary drinks have become a normal part of daily life for many people. Fresh fruits, vegetables, whole grains, and lean proteins are often more expensive and less available, especially in low-income neighborhoods, creating what experts call food deserts, where fast food and packaged snacks dominate. Physical inactivity adds another layer to the problem. Many jobs now involve sitting for long hours, and daily movement has been replaced by screens and cars. Children spend more time indoors on devices and less time running and playing outside. Muscles weaken, bones lose density, and the body burns fewer calories, leading to weight gain and insulin resistance. Exercise also affects mental health and stress hormones, so lack of movement contributes to anxiety and depression, which in turn make healthy habits harder to maintain. Stress itself has become a silent but powerful contributor to disease. Financial pressure, job insecurity, long working hours, social isolation, and constant exposure to bad news keep the nervous system in a state of alarm. Chronic stress raises cortisol, which increases blood sugar and encourages fat storage, especially around the abdomen, and it also weakens immune defenses and disrupts sleep. Poor sleep then worsens appetite control and blood pressure, creating a vicious cycle. Mental health is another major part of the largest health problem, even though it is often treated as separate from physical illness. Depression, anxiety, and substance use disorders are widespread, and they influence how people eat, move, sleep, and take care of medical conditions. Someone struggling with depression may lack energy to cook healthy meals or exercise, while someone with anxiety may smoke or drink to cope. The opioid crisis revealed how pain, mental distress, and social factors can combine into a deadly pattern. Overdose deaths rose dramatically and touched families in every region. Alcohol-related liver disease has also increased and is now affecting younger adults than in the past. These issues are not just personal failures, they are shaped by economic inequality, trauma, lack of access to mental health services, and cultural stigma that prevents people from seeking help early. Access to healthcare is another critical dimension of the biggest health problem. The country spends more money on healthcare than any other nation, yet many people still struggle to afford doctor visits, medications, or preventive tests. Insurance coverage can be confusing and expensive, and even those with insurance may face high deductibles and co-payments that discourage them from getting care. Preventive services like blood pressure checks, cholesterol screening, and diabetes testing are essential to catch disease early, but gaps in coverage and trust keep many people away. Rural areas face shortages of doctors and hospitals, forcing residents to travel long distances for basic care. Urban areas may have more facilities, but not always for low-income communities. This uneven system means that disease often progresses silently until it becomes severe and costly to treat. Health inequality based on race, income, and geography deepens the crisis. Certain communities experience higher rates of obesity, diabetes, heart disease, and infant mortality because of historical discrimination, environmental exposure, and limited resources. Neighborhoods with few grocery stores, safe parks, or quality schools make healthy choices difficult. Air pollution and unsafe housing increase asthma and other respiratory problems. Stress from discrimination and poverty affects hormone balance and immune function, adding biological weight to social hardship. These disparities show that the biggest health problem is not only biological but also social and structural. Another element of the largest health problem is the way healthcare focuses on treatment more than prevention. Many resources go to managing advanced disease with expensive drugs and procedures, while far less goes to nutrition education, physical activity, programs, and early lifestyle intervention. Doctors often have limited time to counsel patients on behavior change, and patients may not receive the support they need to make lasting changes. Food marketing and urban design continue to promote unhealthy patterns, while public health efforts struggle to compete with commercial influence. Children growing up in this environment face unique risks. Early exposure to sugary foods and drinks sets taste preferences for life, and childhood obesity increases the chance of adult diabetes and heart disease. Schools may cut physical education due to budget pressures and rely on processed cafeteria meals. Screen time replaces active play, affecting posture, vision, and social skills. Mental health challenges appear earlier, with anxiety and depression reported in adolescence at high levels. When health problems begin in childhood, they shape the entire lifespan and increase the burden on families and society. Aging adds another layer because as people live longer, they accumulate chronic conditions. Older adults often have multiple illnesses requiring many medications, which increases the risk of side effects and interactions. Memory disorders like Alzheimer's disease are becoming more common, and they demand long-term caregiving and financial resources. Caregivers experience stress and health decline themselves, showing how one person's illness can affect an entire household. The healthcare system is strained by these long-term needs, and families struggle to balance work and care responsibilities. Environmental factors also contribute to the largest health problem. Climate change brings heat waves which worsen heart and lung disease and increase dehydration and kidney stress. Wildfire smoke raises respiratory illness and emergency visits. Extreme weather disrupts food supply and housing, causing stress and injury. These pressures interact with existing chronic conditions, making them harder to manage. Did you know that 7 out of 10 deaths worldwide are now caused by chronic diseases? Things like heart disease, diabetes, and cancer. This isn't just a health crisis. It's a global epidemic that's quietly reshaping our world. For decades, we've seen these conditions skyrocket, and it's not a coincidence. What's driving this? A perfect storm of modern life. Our diets have shifted towards processed foods packed with sugar and unhealthy fats. Our jobs and lifestyles have become more sedentary, keeping us glued to chairs and screens. And let's not forget chronic stress, a constant background hum in our busy lives. These factors don't just make us feel unwell, they have massive consequences. Healthcare systems are strained to their breaking point. Economies are burdened by lost productivity, and most importantly, countless families are losing loved ones too soon. The human cost is immeasurable. So, what can we do? The solution isn't a single magic pill, it's a multi-level approach. On an individual level, it starts with small, conscious choices. It's about creating an environment where the healthy choice is the easy choice. And finally, at the policy level, governments and organizations have a massive role to play. This means promoting clear food labeling, taxing unhealthy products, subsidizing nutritious foods, and investing in public health education. It's about building a society that prioritizes prevention over treatment. This isn't an easy fight, but it's one we can win together. By taking action at every level, personal, community, and policy, we can turn the tide on this epidemic and build a healthier future for everyone. Thanks for watching, and if you found this helpful, please like and subscribe for more content.